Hey guys, Dr. Ben here, FA Well Centers. I'm going to talk today about PCOS. I'm going to talk about where this is coming from. I'm going to talk about what we need to do differently in our lives, in our health, in our eating. All of these different things that can be contributing to PCOS, polycystic ovarian syndrome. So welcome. Again, at FA, it's all about getting to the underlying root cause. Why does somebody deal with this issue in the first place? Whether it's hormones, whether it's autoimmune, whether it's digestion issues, any type of condition, you have to get to that underlying why. So PCOS, polycystic ovarian syndrome. This is where a female starts producing too many cysts on her ovaries. She starts getting cysts on her ovaries, and it's going to lead to infertility, hard time getting pregnant, not secreting eggs like they need to. A lot of different issues come about. But here's the deal, is that most people think PCOS is the problem, but PCOS is the symptom, and you need to figure out why that underlying issue is there in the first place. So the number one thing we see with PCOS is that it is an insulin resistance issue. It's a blood sugar issue. And if somebody is having blood sugar issues, it absolutely 100% of the time throws off your hormones. And in guys, we'll see this where if somebody's blood sugar is too high, they're going to convert. Hey, Carla, good to see you. Pop down any questions down below. Kimberly, good to see you as well. Here's what we see in guys: when their blood sugar is going too high, they start converting their testosterone over into estrogen, and that creates this major issue. And just on that note, we're going to be having a hormone webinar tomorrow night at 6 o'clock Mountain Standard Time. We will be sending out a link and some information on that as well. Pamela, good to see you. So here's what we know is that hormones get thrown off by blood sugar imbalances. So testosterone converts over into estrogen. In women, when their blood sugar is out of balance, especially insulin resistance, we start getting the opposite way. So a lot of women, their DHEA starts going up and their testosterone starts going up. They start getting some chin hair, even getting some balding, some male pattern baldness. Let me know if anybody's experiencing any of that. Put that down below what you guys are seeing. It can be these dark lines in the creases, under the armpits, under the breast tissue, some different places. And what happens is the body is stimulated to make these cysts on the ovaries. And we start having these issues come about where women can have pain, they can have all these symptoms Yep, Heather, unfortunately, it happens, doesn't it? And a lot of abdominal pain issues. It feels like, hormonal cramping, all those things. The hair growing where it's not supposed to and falling out where it's not supposed to. Yeah, proud Texas mom, absolutely. So this is what we see all the time. You're getting hair where you don't want hair. You're losing hair where you want your hair. And that's a big thing that we're seeing. But it's because the hormones are out of balance. It's not because of PCOS. It's because the hormones are out of balance in this underlying cause. So then we take a step back and go, okay, why are these hormones out of balance to begin with? And the next step is then we look at, okay, well, hormones out of balance coming from an insulin resistance or blood sugar thing. Most of the time we see these people spiking up and crashing down. How do we fix it? That's what we're getting to right now. We got LJM52. So yes, this is how you fix that PCOS, is by stabilizing the blood sugar, because every time this blood sugar spikes up, we're going to create that imbalance. Our fibroids also part of PCOS. Not necessarily PCOS, but it's the same underlying issue where the fibroids are going to be created when these hormones get out of balance. So absolutely, great question. Keep asking those questions down below. So when that blood sugar spikes up or when it crashes down, we can see these issues in women. We can see these hormones get out of balance and we get something called insulin resistance. Insulin resistance is where you've got your receptor on the cell, insulin goes into that receptor, and then the cell opens up, we send glucose in, and then you can use your sugar. But what happens is if somebody's doing this over and over and over, that receptor gets gummed up, it won't open up. And so then glucose sits out here, the body kicks out more insulin, when insulin goes up, that's going to cause this. Hey Jen, good to see you there. And Najee, good to see you as well in Boston. And so that insulin receptor gets gummed up because it's doing this over and over and over. And so what we see is that over time, insulin resistance can drive PCOS. There's a couple other reasons for it, but probably 90% of PCOS is going to be a blood sugar thing. This is why so many people get put on metformin that have PCOS. But metformin, again, does nothing to fix this underlying cause. And it's actually, of all the drugs out there, it's probably the most common one that we see that people have side effects to. Not, the worst side effects. Hey, Virginia, good to see you in Kansas there. My kids are over at youth camp in Ottawa, Kansas. I'm not sure if that's close to where you guys are at or not, but it was a long, hot drive, I think. So the PCOS is going to be driven by these blood sugar swings. So what do you need to do? Here's the deal. If everybody that had PCOS, if everybody, even fibroids, hormone issues, any of these things, if they would go and stabilize their blood sugar, we would see amazing, amazing changes in these hormone issues and this PCOS. Hey Jen, in St. Martin in the Caribbean, good to see you. So here's the thing. Somebody just asked, how do we fix it? And the number one thing you do is to start stabilizing your blood sugar. We have patients, you can either finger prick and start checking your blood sugar. You want it between 85 and 110 all day long, or you can start wearing a continuous glucose monitor. This is something we do with every one of our new patients. And you're going to see continuously throughout the day what that blood sugar is doing. And if it's out of balance, then you need to do more of the good stuff and less of the bad stuff. Michelle, is intermittent fasting good for PCOS? Here's the deal with intermittent fasting. It's not a one-size-fits-all for everybody. And what we see is that if people are going hypoglycemic, if they're crashing down, that actually drives the adrenals. It stimulates the adrenals, number one stressor to the adrenal glands, and it's going to drive that adrenal fatigue and this chronic stress. And so if somebody is going hypoglycemic and they're intermittent fasting, it can actually cause more problems. So that's where blood sugar monitoring, glucose monitoring is so crucial for you to be able to see exactly where that is going to be in there. So intermittent fasting, maybe not, depends on somebody's blood sugar. Some people swear by it, but it is not the be all and end all. Lisa, good to see you there. And this is Angel Fun, my hormones. Hold on. My hormones are all over, but that's because I believe I'm pregnant. Yes, Angela, if you are pregnant, that could definitely throw that. Hormone replacement. Not sure what the question is there, but would hormone replacement help PCOS? No, that is not the solution. You do not want to go and just start taking some other hormones and slathering up with some other hormones, because that is not going to fix this underlying root cause. You've got to fix the why. And if somebody still needs some type of hormones, then you could. Proud text about I had PCOS for 15 years, so glad it's finally becoming something doctors address. Absolutely. And so here's the deal, Proud Texas Mom. I'm sure if you went and started tracking your blood sugar, you would not be stable where you need to be, 85 to 110 all day long. Sure, there's going to need to be some liver support and working on the gut and make sure you're detoxifying and all these other things. But if you don't stabilize your blood sugar, you are not going to fix your PCOS. And do you have insight in blood pressure spikes randomly? Any link to Hashimoto's? Absolutely, Lisa. This is one of the things that we can see when somebody goes into an autoimmune flare. They can actually break down more thyroid tissue, spill out that T3, T4 into the bloodstream, and then the thyroid hormones spike up. And that can absolutely be a big cause of this blood pressure spikes. It can also be, like we were just saying, when that blood sugar crashes down, the adrenals are stimulated, then we have adrenaline flowing through the body, and it's going to drive, I call it random anxiety, but it could also be that blood pressure as well. But the blood sugar swings every time that blood sugar spikes up, every time that blood sugar crashes down, you're driving more inflammation and damage to the Hashimoto's and that whole autoimmune cascade. Is there a way to tell for sure if you're menopausal? This is Tess. Yes, absolutely. So that would be looking at your hormone levels in your blood work. If your doctor won't do that, let us know. We can drop ship blood work anywhere in the country. There's a link in the bio. You can schedule a discovery call. We can talk about what that process looks like. If you're close to Colorado or Tennessee, come and see one of our offices, and we can do that as well. So that is going to be the best way. And if there's like no estrogens, very low, there's definitely things we're looking for, but that's going to be the best way is to tell that. Denver, El Joe, hello, good to see you. Proud Texas mom. So is berberine a better choice? So better choice than metformin? Here's the deal. I've done multiple videos on that. Check my feed on TikTok there. Is berberine better than metformin? Maybe. Here's what's better. Maybe it has less side effects. Maybe it's not. Some people do fine with metformin. Some people, read the list of what people have said that they've experienced as they've gone through and had these issues taking metformin. You can read all the side effects that they talk about. So maybe, but if somebody's doing fine with metformin, then is it better? Probably not. But here's the deal: neither berberine or metformin are going to fix the root cause, which is the blood sugar imbalance. And what is that? That's putting the food in your mouth. You are putting the wrong things in your mouth at the wrong time, having these issues. So berberine is not going to fix anything. Pamela, how do you know if you have insulin resistance? I get so sleepy after I eat. Also believe hormones are wacky. I'm in menopause now, but always had heavy clotty periods my whole life. Have dealt with anemia and low B12 and vitamin D, low iron as well. The low iron isn't as bad now since not having a period. I've just struggled with my weight since being in perimenopause and going into menopause. So how do you know if you're insulin resistant? Thanks for all the heads up there. How do you know if you have insulin resistance? This is why we do all of our blood work non-fasting. And so we want to see where is that blood sugar, where is that insulin throughout the day, randomly, you've eaten, and we want to see what it is. If your insulin is over 15, 20, 25, non-fasting, you're creeping into insulin resistance. If you're 40, 50, 60, you are probably insulin resistant, and you need to take those steps to change it. But here's the great part. If you stabilize your blood sugar and get it in between that 85 to 110 all the time, you're going to be able to reverse your insulin resistance. We see this all the time with patients. So absolutely, that's one of the best ways that you can tell if you are insulin resistant. Debbie, thank you for talking about PCOS. I've been dealing with it for 30 years and never really knew about it. Education is important for people going through it. Absolutely. Can you imagine PCOS for 30 years? And I mean, Debbie, what they do, put you on metformin, talk about your blood sugar maybe, but probably not, but definitely didn't tell you what to do. So here's what you do, is you need to eat food that is going to keep your blood sugar as stabilized as possible. And you need to, here's a couple tips. Don't drink your calories. So any calories at all, do not drink it. Any sweet tea, any sodas, any type of Gatorade, Monster, anything like that. Do not drink calories. Can POTS be related to insulin resistance as well? So POTS, Michelle, remember POTS is going to be when that blood pressure crashes down, and that's an adrenal thing as well. So insulin resistance can be affecting the adrenals, especially when we see the blood sugar crash down, revs those adrenals up. So it's all interrelated, and the adrenals give tone to our blood vessels. So absolutely, that can be part of it. What can we do naturally? So Rosie, here's the deal. You can take berberine, you can take cinnamon, you can do all of these different things for your blood sugar and then to help PCOS. But ultimately, you need to fix and stabilize your blood sugar. I wrote an entire book on this. Blood Sugar Doesn't Lie. You can get it on Amazon. Brittany, go ahead and pop the link down below there. And you need to get that blood sugar as stabilized as possible. As you do that, it's going to start changing what your insulin resistance is doing. It's going to start changing what your hormones are doing. Yes, there's DIM, D-I-M. There's the berberine you can take. There's liver detoxification. All these things are going to help your body process out the hormones. But ultimately, if you're still having insulin resistance, it is not going to help. This was Professor X77, metformin destroyed my stomach, and so did the other pills I tried, so I switched to insulin. So Professor X, I would say, okay, that's great, you're on insulin and it's doing some things there, but you probably have insulin resistance. Your pancreas probably isn't making enough. So you need to do whatever you can by putting the right foods in your mouth to stabilize that blood sugar. Dude, that's bogey. So PCOS equals diabetes? Not necessarily. I see PCOS people that are crashing as well, and so they're going to be spiking and crashing, and their A1C, which is that diabetes marker in the blood work, is actually in a good average, but they're swinging 100 points in a day and they have insulin resistance. So it just doesn't mean that you have diabetes if you have PCOS, but there's a good chance if you have PCOS, it's insulin resistant, and you don't do anything different, you will get diabetes someday. That's absolutely what we're looking at. And total hysterectomy at a young age. Hold on a second. Where did that go? I lost you. Let me scroll back through this one. There it is. Total hysterectomy at a young age. Should I consider hormone replacement now in my early 50s? I think you should get, and this is ACG Guaca. I would say if you can check your hormones, see what's out of balance, and get your body as strong and as good a shape as possible. And then if you still need some hormone replacement, you're going to need a very small amount, and it's not going to be as dramatic to the body. So don't just start with slathering on a whole bunch of hormones if you are not getting to the root cause first. Are you against medication and believe diet and exercise are enough? This is Marty. So I'm not against medication. That is not what I'm saying here. I'm saying that if somebody needs medication, if you've got a root canal infection in your mouth and you need an antibiotic, you got to do what you got to do. When we're talking about metformin, when we're talking about blood sugar medications, things like that, and if somebody has type 1 diabetes, obviously you got to be on insulin. But otherwise, if somebody is willing to put the work in, so Marty, if you're willing to put the work in and make the changes and put the different foods in your mouth, all of those things, then yes, I believe diet and exercise are enough. I've seen it 100,000, 10,000 times with patients where they are able to actually, they do what they need to do. They reverse their type 2 diabetes. They're able to get off of insulin, get off their meds, all of those different things. So how do you keep it stable? So how do you keep your blood sugar stable? This is the easy part. Well, simple. It's not necessarily easy, it's simple. And you're going to eat foods that keep that blood sugar as regulated as possible. I don't have a diet, a menu, a meal plan, anything in my book because it is so unique. Some people, watermelon, they'll hit 180. I don't want you over 110. Some people, they're going to be having just fine with beans, with black beans. Other people, black beans are going to make them go up to 140. So it's very much unique as to what you have going on. And so that is how you keep it stable. So by eating what you're going to be eating, oh good, just signed up for the webinar, awesome. How do we keep it between 80 and 110? So I don't even like it under 85 is my ideal. Maybe in between a meal you could dip down to 80, but 85 really is going to be that sweet spot. So how do you keep it between there? You're going to eat foods that are going to keep it stabilized. And that's the easy part. It's not cinnamon, it's not berberine, it's not metformin, any of those things. But you go, okay, here's what you do. I'm going to give away my the secrets right now, and these are the tips. You're going to eat meals that keep you as steady as possible. So you find a meal or 2 or 3 or 5, you find those meals that keep you steady. And then you go, okay, great. I only went up to 106 after that meal. Great. Now let's try a little bit of rice. Let's try some sweet potato. Let's try some acorn squash, butternut squash, whatever it is. You try that, and if it works and you only go up to 108, great. If you go up to 128, not going to do that. So you find out what works, and then you start challenging that with things and see what does work. Yep, you are welcome, Lisa. I do work with people on Zoom. I'm from Ireland. Yes, so click the link in the bio, and then anybody on YouTube or Facebook, just send us a DM and we can talk to you about what that process looks like. Schedule a discovery call. That's going to be the easiest way to do it, and we can sit down with you and talk to you about what the process looks like and go through there. Can you explain what orthostatic disorder is? So I'm thinking you're talking about like a POTS type of a thing where that blood pressure does not stabilize. Hold on just a second there. So Trish, how long after a meal do you test? If you're finger prick testing, 45 to 60 minutes after eating that meal. A lot of people say 2 hours, way too long. Some people spike and come down even within 30 minutes. So at 45 to 60 is a good number if you're finger pricking. If you're doing the continuous glucose monitor, you can see it the whole time. So can you explain what orthostatic disorder is? So if you squat down and your blood kind of pools down in your legs, you stand up fast, it should pump up and get to your brain very quickly. Otherwise, if you do that and you stand up and you're like, ooh, the world kind of narrows down, you get tunnel vision, you have to grab onto something, that is not going to be a good pumping of that blood, and your blood pressure probably goes down. But here's the deal, your adrenal glands give tone to those blood vessels, and so it pumps that blood up towards your brain and keeps it flowing like it's supposed to. But if you have adrenal fatigue, adrenal stress, if your blood sugar is swinging, especially crashing, you're stressing out your adrenals, jobs and cars and kids and COVID and presidents and gas prices, whatever you want to stress about, that's going to be contributing to that adrenal stress as well. And so that's one of the biggest indications of adrenal issues is if you're sitting or lying down and then you stand up quick and you get dizzy. Hey, Grateful Garden Song, good to see you. Hair Diddy 2, howdy from Branson, Missouri. Great to see you. 2 of our team members actually live in Branson. We love Branson. My parents, that's actually my mom in Mountain Home. That's where she found her doctor that helped her heal her MS. And thank you. Hello there, Asian doctor. PCOS and pregnancy, Helen. Yes, so PCOS can absolutely slow down one's potential for getting pregnant. Yeah, that's what we see all the time is that PCOS. If you're making cysts on your ovaries, you're not going to be releasing your eggs like you need to, and it is really going to throw off someone's ability to get pregnant. And is there a way to tell for sure if menopausal without going to the doctor? So yeah, we can actually drop ship a blood test kit to your door. You can go and get it drawn or have a phlebotomist come to your house, draw that blood, send it off to the lab, and then we go over it remotely with you, and you wouldn't have to go to the doctor. So that would be one of the best ways to do it. You can actually see those. So what type of monitor should we get to keep track of blood sugar? I know I'm not always eating the right things. Pamela, so a finger prick, just go on Amazon, you can get a $30, $40 one. That's what we get in the office. But if you are really wanting to get the underlying where those ups and downs are and the easiest, that's the continuous glucose monitor, and that's what we do with our patients every single day. If you're not getting the results you want and you want more support, click the link in the bio. If you're on TikTok, on Facebook, or YouTube, just send us a DM and schedule a discovery call, and we can sit down and let you know if you're within a radius and can get to Tennessee, can get to the Colorado offices. Pop in, we'd love to see you. If you're not able to do that anywhere around the world, let us know and we can work with you remotely and help you guys through that. So yes, so you can, I have PCOS and I have 2 girls. Yes, so PCOS does not mean you're infertile, does not mean you'll never have babies. Obviously, some people still get pregnant with PCOS. It can be more of a challenge. And really, who is it? Not sure what that means. Do you work with people on Zoom? Absolutely. So we can drop ship that blood kit to you and gather all this information and sit down and review that as well. Okay, once I get to the 85 to 110 range, how long until I start seeing changes? So we will see people even in the first week. One of my last PCOS patients, literally 3 or 4 days in, and she was like, "I'm feeling so different already." But usually within the first couple of weeks, people start feeling a noticeable difference in the first 30 days, probably down 10, 15 pounds, energy's better, and really go through there. So you'll see some changes pretty quickly. Liver issues, I was hospitalized in May with a 198 and 108. All testing was negative and great. So did you, and this was Lindsay Lee, did you test your GGT? If you didn't test your GGT, then you don't know what that liver enzymes were up from. If it was GGT was high as well, then you're creeping into fatty liver. If it's not, then it may have been more of a viral infection as well. What about juicing and smoothies for PCOS? Here's the problem with juicing and smoothies. A lot of juicing, you get carrots, apples, beets, all these things that are going to spike that blood sugar up. Smoothies, here's the juicing, you don't juice broccoli and kale usually. And smoothies, there's usually fruit, there's other things in there. So both of those have the potential of spiking that blood sugar up. I saw a guy that was diabetic one time in his early 40s because he was going and getting this 64-ounce smoothie every day, thinking he was doing good work for himself, but he was actually spiking that blood sugar all the time. Artificial sweeteners a factor in PCOS? Not directly, but what artificial sweeteners do is they don't satisfy your craving for sweeteners, and they're going to make you keep craving a sweetener. But here's the other thing is it can actually drive your insulin. Even though you're having an artificial sweetener, your body can still be like, ooh, that's sweet enough, it must be glucose, but it's really not. So it can actually drive some insulin as well. Do you like alpha lipoic acid? This was Crafty, One Love. So alpha lipoic acid, it's fine. It's a nice supplement. It can do some different things. Just like Shelby, she just asked about inositol as well. Those are fine. And yet, it's not going to fix the underlying cause. If that's all you do, you can't out-supplement PCOS. You can't out-supplement insulin resistance. You can't out-supplement hormone imbalances. You've got to fix the why. So your liver, you've got to make sure that's detoxifying like it's supposed to. Your gut, you need to keep the bad stuff out and make sure you're preventing autoimmune from jumping in. Inositol, it's something that we use with patients with PCOS occasionally, and yet that's not like, oh, here, take this inositol and you're going to be fixed. Does getting control of sugar help with fatty liver? Michelle, we've seen people's GDT go from 65 down to 6 in 3 months. People can truly reverse their fatty liver very quickly if they do what they need to do. Sure, there's extreme cases and different things, but I've even had a patient, she had autoimmune to her liver, and she was 23 years old. She was on a liver transplant list, and she developed this from being in an environmental setting where it was really toxic. And we got her healed up her body enough that she quit attacking her liver. She was able to get off the liver transplant list and make some major changes there. So we can see this change amazing. My best friend has ferritin. This was the lip loft. My best friend has ferritin levels of 1300, extremely high. Would reducing sugar intake help in the meantime? Absolutely. I would, for most people, if it's up that high, it'd be good to go and give again, I'm not giving medical advice for your best friend through you, but this is what most people do if they've got ferritin levels of 1300, is to go and donate blood and slough off some of that blood. But yes, most of the time, when we see this, we know that there's a blood sugar imbalance. We know that there's an insulin resistance and inflammation, triglycerides are high, all of these other things. I don't like ferritin for a female over 125. Hey, Michelle, I'm going to schedule a virtual visit. Awesome. I look forward to talking to you. And have had POTS symptoms for years. This was Jessica. So we are able to see people heal up from POTS, especially if there's a metabolic issue leading to this: adrenals, blood sugar, inflammation, all these different things. So we're able to see POTS get better. So there is hope definitely for you. All right, this is Elizabeth Conklin. I have lost over 60 pounds, not because I wanted to, but because I cannot eat. So that is not good. Something is off. And when you start thinking about digestion, you've got your mouth, you got to chew well enough, kick out saliva, you got to kick out enough stomach acid, your gallbladder and liver need to be kicking out bile to break down fats, your small intestine needs to be kicking out enzymes, breaking down food that way, keeping things out, and then your microbiome in your large intestine needs to be appropriate and making those good changes. So absolutely, you've got to dig deep and figure that out. And oh boy, I missed a bunch of questions here. Sorry guys, there's a lot. How soon after a meal should you test? 45 to 60 minutes on there is a good one. Debbie, I know the doctors don't like to remove the ovaries before going into menopause. I suffered with constant cysts over the years. I just had emergency surgery to remove an 8.5 liter cyst and a 1 liter cyst. They finally took my ovaries, thank goodness. So yeah, yes, in emergency surgeries, you gotta do what you gotta do. But here's the deal, is that a lot of people do not need to get to that point. If they have the time and energy and knowledge and could get it figured out, so many people could prevent that if they would go and get the metabolic answers, if they'd run the blood work, if they'd go through the whole process and figure out what's truly going on there. So, and how do you control blood sugar when you have reactive hypoglycemia as a result of bariatric surgery? So obviously you're not going to be able to eat very much after that bariatric surgery. So what you need to do is you need to eat often. You're probably going to need to eat 6 to 10 times a day, smaller meals. What we found with our patients is that most people, if they can get enough fat in their meal, they are going to be able to keep that blood sugar stabilized. If all I eat is some chicken and some romaine lettuce and no fat on there, within an hour I'm going to start going down. I'm going to be bruised and hungry, etc. But if I go and add enough fat to that meal, I'm going to be fine. It's going to stay with me. So add some more fat, and you're going to need to eat more on that. This was, Mama, will you invite me when you talk on MS? Yes, check out some of our other videos on there, and you can see those. Jennifer, good to see you there in Iowa. Reactive hypoglycemia with PCOS. Yes, that's what we see all the time. It's these swings. PCOS, it's not usually just high blood sugar all the time. It's usually these ups and downs, ups and downs. We'll see 100, 120 point swings when people are out of balance there. Nancy, good to see you in Texas. Denise as well. And today's my birthday. All right, happy birthday. Does PCOS affect IVF outcomes? I'm about to start IVF. You know, I have not had any patients specifically going through IVF and having PCOS. I would guess that it's not necessarily the PCOS that would affect the IVF outcome. It would be the metabolic syndrome, the insulin resistance, the inflammation, the hormone imbalance, all these other things that are causing the PCOS that are going to be affecting IVF outcomes. So I'm doing IVF as well. So here's the deal. If you get your blood sugar stabilized, if you get your liver going, if you get all those things going, it's going to be way easier to get pregnant. We see it left and right all the time. Dexcom G6, Shayna, yep, that's what we use with our patients every single day. And what tests should be done as far as test to check for menopause? So yes, you want to check your 3 estrogens, your progesterone, and that's going to be a good foundational piece to start with. What can I do for acid reflux? My ears have been hurting when I feel that acid level. So like we always talk about, 3 things that you can get started with. You're going to not drink fluids with your meals. So keep that, no fluids. It's going to dilute the stomach acid. It's going to sit there too long. The food is, and it's going to start regurgitating up. Number 2, you're going to properly combine your foods, which is going to be no proteins and no carbs together. So you keep your proteins and carbs separate at your meals, and then you want to eat in a relaxed environment. So start there and see what happens. Would fasting or intermittent fasting be a way to start figuring out blood sugar and insulin resistance in addition to the testing after eating? I have a lot of food sensitivities. So Pamela, again, if somebody is dealing with a hypoglycemia, or a bunch of these people talking about reactive hypoglycemia, intermittent fasting is not a good thing to do. It's going to be very stressful on the body. So again, you need to know. Do you recommend berberine? Berberine's fine, but I would much rather somebody fix their blood sugar and fix their liver and fix their hormones. How do we find expert doc who does this? This is Andrea. So, if you're not able to find somebody local, let us know. If you can get into Colorado, if you can get into Tennessee, come to the office, come see us. If not, we can drop ship blood work anywhere in the country. One of my FA doctors will work with you or myself, and we can go through the process and figure out what is going on. Yep, so the 17-year-old son will get dizzy when standing up. And this is Ginger Lindsay. When he stands up from sitting, should I be concerned? So again, he's probably got hypoglycemia. He's probably got adrenal fatigue. He's probably not eating like he needs to. His blood sugar's probably swinging all over the place. So you've got to support those adrenals. You got to get that blood sugar. And 53, losing so much hair, testing for thyroid issues, no results. What could be the cause? So check your, this is love and peace. So check your testosterone, your free and total testosterone. It may actually be too high, and that could be causing some of that male pattern and baldness if you're getting it. Yeah, so I have PCOS and get 2 periods a year, and metformin hasn't helped. Is there anything else to help? Yeah, so again, just by taking metformin, you're not fixing the blood sugar. You didn't, maybe it suppressed it from spiking a little bit, but you didn't help the dips probably. If anything, it maybe even made it go lower. So you've got to figure out that blood sugar. You've got to look at the liver, see if you need to detox that, work on that leaky gut, all those different things. Does PCOS make IVF less successful? I'm starting IVF soon, and I'm so scared. Again, like I just said, PCOS doesn't necessarily affect the IVF, but the things that are causing the PCOS absolutely have affected you from getting pregnant, and absolutely can slow you down from getting pregnant as well. Do you recommend berberine? It's fine, but again, you can't out berberine a poor diet. That's not going to fix it. And I have male pattern baldness, absolutely. How much is it called? So $260 for the blood work, and then it's like $100, and we'll sit down and review that with you as well. So just click the link in the bio, and we will we'll schedule that one. And where's clinics in College? We have one clinic in Fort Collins and one in Denver on the south side, Highlands Ranch. So either one of those, if you guys want to come in. I'm in the Fort Collins office. So I was diagnosed with PCOS due to lack of menstruation and sort of high testosterone. Any tips? Yes. So here's the deal. You did not get PCOS because you had lack of menstruation. Maybe you were diagnosed with it because they said, oh, your menstruation isn't great and your testosterone is high. But those are not the cause. That you got to take a step back and figure out the cause of not menstruating, the cause of the high testosterone. And that's where a lot of times it's a blood sugar issue as well. Can PCOS cause constant nausea, vomiting, diarrhea? No, those are two different things. We will not see that. You need to figure out why you're having that nausea, why you're having that vomiting, why you're having that diarrhea. That is, those are going to be more of a gut thing potentially. You've got to dig deep, figure out what's going on there, but that is not going on. Rheumatoid arthritis, this is Nurse Grant 09. Yeah, so RA is an autoimmune disease. Anytime we talk about autoimmune, check out our YouTube channel. We've got tons of videos on there. It's just under my name on there. And you will find a lot of information on autoimmune that is going to help calm that down and help get that into the right range. So, and also have more male hormones than female hormones. Yeah, Mama Pedro. Yeah, we see that all the time, is that the estrogen start crashing, the testosterone and DHEA are up too high, and that is very indicative of somebody having a PCOS. I have gastroparesis, and July 7th had 6 clips put in my stomach. That is horrible, Lisa. Gastroparesis is something we see all the time, and that can be helped. Polycystic ovarian syndrome, you know. So hair loss, it could be post-COVID, it could be a high testosterone. You want to look into that. I was diagnosed with PCOS and still was able to conceive twice. Was it a misdiagnosis? Not necessarily. So PCOS does not 100% everyone is screwed and they can't get pregnant. That's not what that means. It makes it more challenging. The cysts on the ovaries, all of that, but it doesn't necessarily mean that's true. It could have been a misdiagnosis as well. Is it possible to have PCOS but never have blood sugar problems? Sure, anything is possible. We can see a lot of these issues come about from various things. The majority, probably 80-90% of people are going to be having blood sugar problems, but here's the deal. You're probably just looking at your A1C and your fasting glucose and they're both okay. So just because you don't see those markers out of balance does not mean that your blood sugar is fine. I would bet if you have PCOS, yeah, if I bet 100 people that their blood sugar's off, I would win 95% of the time. I would win 95 out of 100 there. So I'm very surprised. I see blood when I spit out and I have in my stomach. My doctor sent me for an x-rays. What do you think? Najee, I think x-rays are a weird thing to do when you're spitting up blood. I would definitely think about doing a scope and seeing what's going on there. What will get excessive facial hair to stop growing with PCOS? Terry, you've got to fix the why. Fix why somebody has this excess facial hair growing, and you're going to be able to then get the hormones, because it's testosterone and DHEA, you're going to be able to get those to start going lower. And so there's no thing to stop the PCOS necessarily, or stop that growing because of PCOS, because it's not because of the PCOS. The PCOS is a symptom, and hair growth goes along with that. So you've got to stabilize your blood sugar, you got to work through your liver, make sure your gut's in good shape, get into a good place with stress, all those things. So let's go here, jump down. Man, we got a lot of questions. I got to jump here in a minute. Do you recommend apple cider vinegar and lemon juice daily? Totally fine, especially if you've got some digestion issues. My estrogen is high all of a sudden. Yeah, so you've got to look more in detail, see what's going on. Did you check your testosterones, and go from there? And does L-glutamine help with leaky gut? Sure, that's one of the common things that we use with patients, is L-glutamine. But remember, you can't glutamine out glutamine, leaky gut, if that's all you're doing. Just take glutamine. No, that's not going to fix it. You've got to calm down the inflammatory process. You got to kill off bad bacteria, yeast, all these different things, build it back up, do a bunch of different things. So here's the deal, guys. Shoot me some questions. I got to jump. I got to go see patients, but shoot me some more questions wherever if you're on YouTube or Facebook or TikTok. Just send those either direct message or in TikTok. There's a Q&A button in there as well. Ask a question. I will respond to those as quickly as I can. So love having you guys on again tomorrow night, 6 p.m. Mountain Standard Time. We're going to be doing a hormone webinar, so we'll be getting in depth into a lot of these thoughts and get you guys as much actionable things as you can to take movement every single day to get your life back and to get as healthy as possible. So thanks for being on, guys. Love seeing you. Take care.